Okay, we are going to go ahead and get started. We are officially on week 5. Oh, there's a couple more people in the waiting room. There we go. And do a quick screen share. All right, let's get started. Okay, today we're going to go over the bunny lines. We're also going to talk about the chemical peel, and this is actually one of my favorite weeks because I get to add a new tool to your toolbox, and this is the chemical peel. And then I talk about AR, common errors, and then we have our marketing homework. Okay, so let's talk about the bunny lines. So the bunny lines are formed for 2 reasons. The first, it can be from nasalis. So the nasalis muscle is the muscle that's on your nose and it wraps around your nose. And it is normally a depressor muscle group, right? So Mother Nature made it be a depressor muscle group. So it makes you kind of crinkle your nose and it kind of shortens and comes in. And it forms these kind of lines across your nose. Another reason why you might have quote unquote bunny lines is because of how Procerus may be firing or may be attached to the underlying bone at the bottom. Sometimes that attachment is very strong. And so then whenever you collapse or frown or activate your glabella complex, your Procerus will bend down and you'll get this horizontal line across the bridge of your nose that goes right across here. Not everybody has that. Again, that's really just kind of the way that Mother Nature made you. But that can also be perceived as a bunny line. So you can treat the bottom of Procerus as well. So you want to treat this with 2.5 fluid units. This is really the only injection that I will have the patient activate the muscle while I'm injecting. And the reason why I do that is because 1, it gives me just a little bit more tissue to work with. And then the second reason, it tends to be a little bit more comfortable with the patient whenever that muscle is activated and I'm injecting. So very small amounts of neurotoxin is being put in. And also whenever I'm injecting the bunny lines, I always make sure that my fluid is going medial. So I want to double check which way that my needle is facing. So the fluid is going to go towards the center and not kind of seep out to the side. Okay. I have a little video. You can see kind of crinkled up on the side. Just gives you a little bit more tissue to work with. And these riders can kind of go all the way down the nose as well. So normally it is a depressor muscle group. When you soften it, it does tend to kind of elevate a little bit. And again, these are the true lines that are formed from the nasalis muscle. So 2.5 fluid units, which is the equivalent of 1 of Botox, 1 of Jeuveau, and then 2.5 of Dysport. Any questions on the bunny lines?
No.
Perfect. All right, moving on. Okay. Was there assessment at large? As officers secure the okay, so now we are going to watch a video about the perfect derma peel. I'm human. I'm human. Okay, if you cannot hear this, please let me know, okay?
Welcome to the Bella Medical Products training video. In this video presentation, you will meet some of our corporate staff, receive additional product information, hear testimonials, and view demonstrations of the perfect derma peel application. Founded in 2011, Bella Medical Products is dedicated to formulating innovative, result-oriented skin solutions for the aesthetic medical industry. Ranked as one of the top 3 new anti-aging products of 2011 by ABC News, the Perfect Derma Peel delivers healthy, ageless skin for all skin types and ethnicities. Bella Medical Products advocates the practice of less invasive cosmetic treatments by providing cutting-edge products to plastic surgeons, dermatologists, cosmetic physicians, and other medical professionals. The Perfect Derma Peel and the Perfect Skincare System product line allow us to offer an exciting new future for skin transformation.
The Perfect Derma Peel is my go-to peel for all of my clients because of its versatility for all skin types and skin issues. I love how the Perfect Derma Peel has little discomfort, and with such little downtime, the results are dramatic.
My clients have benefited from the Perfect Derma Peel for several years now. Applying the Perfect Derma Peel is very easy, and our patients are thrilled with the results.
The Perfect Derma Peel by Bella Medical Products is committed to providing skincare products that deliver superior results to the aesthetic medical community. The Perfect Derma Peel is a safe and effective treatment for aging skin and is the only peel to feature glutathione, an antioxidant with powerful anti-aging benefits. The Perfect Derma Peel is available throughout the U.S. and is growing in popularity worldwide.
Hi, my name is Lana Petrovic. I'm the Director of Operations for Bella Medical Products, and I'm going to explain to you some of the benefits of the Perfect Derma Peel. The Perfect Derma Peel will improve the overall clarity, tone, and texture of the skin, reduce or eliminate hyperpigmentation and melasma, control acne, remove or reduce sun damage, soften fine lines and wrinkles, and minimize the appearance of pores. The Perfect Derma Peel is beneficial for all skin types and all ethnicities.
I feel very comfortable using the Perfect Derma Peel because it's very safe, and at the same time it's very effective, very result-oriented.
The Perfect Derma Peel is one of the easiest peels I've ever performed. I've been giving peels for 20 plus years in this business. It's 1, 2, 3 easy. It's a half-hour process. They're fairly comfortable throughout the entire procedure. It's great. They're up, they're gone, they're fine. They absolutely love the result. It's a great thing to do when you're preparing to go on a vacation or a wedding. Anytime you want your skin just to look flawless, they absolutely love the Perfect Derma Peel.
Hi, I'm Michelle Ray with Bella Medical Products. The Perfect Derma Peel is a medium-depth medical-grade peel featuring a unique blend of acids that address many common skin concerns. The peel contains TCA, retinoic, salicylic, and kojic acids, phenol, vitamin C, and antioxidant glutathione. Each acid is under 12%, and the peel is pre-mixed for easy application.
I really enjoy working with Bella Medical because the customer service is amazing. I mean, I've never had any issues. It arrives on time, the product is consistent, and they're really easy to work with.
I am Nafis Sabai, the founder and CEO of Bella Medical Products. We are committed to providing skincare products that deliver superior results to the aesthetic medical industry. We are happy to welcome you as a provider of the Perfect Derma Peel.
Hello, my name is Juliana Wagner. I am a licensed esthetician of 20 years, and I'm also the senior trainer for Bella Medical Products, and we're here to do the Perfect Derma Peel today. So Natalie has concerns with fine lines and wrinkles, so we're going to do the Perfect Derma Peel on her today to bring back that healthy glow to the skin. So what we prep the skin with prior to the peel is 100% pure acetone. It degreases the skin so that the peel gets down into the skin evenly and deeper into the skin as well. I'm going to have you hold your breath and tuck your lips, please. Any areas of concern, such as fine lines and wrinkles, as well as hyperpigmented spots, deeper lines, you want to be more aggressive with your acetone in those areas, again, to get that peel down in there to do a better job. A good 2 to 3 passes is necessary. Next, we're going to go ahead and put the peel into the cup here. And you're going to want to apply it with one of the 2x2s that come with the peel. And you're going to fold it into a little bit of the square. In our first pass, we're going to go lightly just to numb the skin. How are you feeling, Natalie?
I'm good.
Good. So the active ingredients in the Perfect Derma Peel is the TCA, salicylic, retinoic acid, vitamin C, glutathione, kojic acid,
It's kind of tickle now.
and with the phenol in there, you don't have to have the pain. We're going to feather into the neck 1 to 2 layers, and directly underneath the eye 1 to 2 layers as well. I'm going to have you look up towards me, please. And go ahead and close and relax. You're going to layer the peel till it's gone. You're going to look for frosting as your end point, as well as erythema. You want to redip often into the cup so that it stays nice and even throughout the peel. Maybe look up towards me, please. And that'll be the last layer underneath the eye as well into the neck. And then we'll finish the peel throughout the rest of the face. Almost done here. And you just want to work it through once your cup is empty till your gauze is practically dry. And that's it. As simple as that. So next, we're going to go ahead and go over the post-peel kit with Natalie. Natalie, the peel is supposed to be left on in 6 hours. It self-neutralizes. So you can wash your skin in 6 hours, but preferably I'd like you to go ahead and leave it on overnight if you're not uncomfortable in any way. In the morning, I'll have you wash with a very mild cleanser, and then you're going to go ahead and I'm going to recommend that you take one of the 2 towelettes that are in your post kit. I'm going to hand you the directions as well. And this is a towelette that you're going to use on clean, dry skin tomorrow morning. And this has vitamin A, so it's going to help to expedite the peeling process. So we'll go ahead and you'll use the towelette fairly aggressively. You're going to rub throughout, make sure you get under the eyes really well, and also feather it into the neck. You're going to go ahead and wait at least 30 minutes before applying any sunblock on top. And then you're free to wear makeup that day if you choose. Then that evening, I'm going to have you go ahead and I'm going to have you cleanse again. with something mild again, and then go ahead and use your second towelette. And again, very aggressively, you want to rub it throughout the face, feather it into the neck and under the eyes, and then just go ahead and sleep with that on overnight. Okay? Then after that, the next day you're going to start to see that you're going to start to peel around the mouth. And that's where we talk and move our skin the most, so it'll peel first, and then it's going to kind of just slowly peel out for you. So during that process, you're going to use the hydrocortisone 1% cream that's in the kit as well, and that's all you'll need along with your sunblock. Okay, and then it is a 7-day process, and then you're going to just look beautiful and glowing as you naturally are.
Thank you so much.
All right, thank you. Prior to the application of the Perfect Derma Peel, it's important to go over the contraindications with your patients. Contraindications include pregnancy, breastfeeding, Accutane use within the last 12 months, hypersensitivity to any of the peel ingredients, or aspirin allergy. Do not apply to skin that is still irritated from any harsh treatments such as lasers, waxing, electrolysis, or chemical exfoliants. Do not apply to open wounds, sunburn, infected skin, cold sores, herpes, or lesions. It is important to advise patients with a history of cold sores to be given an antiviral prior to the peel. For overall rejuvenation, we recommend doing the peel no more than 2 to 4 times per year. However, for chronic conditions such as acne, hyperpigmentation, melasma, and concerns with fine lines and wrinkles, we do recommend a series of 3 peels 30 days apart. For thicker and more resilient skin types, melasma, and acne scarring, we recommend adding the Perfect Derma Plus Booster to the peel solution for optimal results. The peeling process will vary per person based on skin type and skin condition. The peeling process will start within 48 hours, intense peeling for 2 to 3 days, and an additional 2 days remaining with the residual around the hairline and neck areas.
If you have any additional questions or need more information, please feel free to contact your local sales rep or our corporate headquarters.
All right. Any questions about the Perfect Derma Peel?
No.
No.
So I always recommend that y'all do it on yourselves first before you try it on a patient. That way, or your husband, that's a great person to try it on too. You can try it on your spouse. That way you know kind of what to expect and what to feel. It is a peel. So I always want to try to tell people that it's not like a light dusting. It's like a snake peel. It is incredible what you can get. It is baby soft skin underneath. It is really zero pain, unlike some of the other ones you actually have to be sedated for. It is self-neutralizing, so you don't have to worry about the patient, setting a timer to neutralize the acid. It really is an incredible peel, and it gives you great results. What I'll do is I will typically tell people I'll kind of alternate peel, microneedling. So really kind of 4 times a year, they are getting some type of skin resurfacing between the microneedling and the peel. That way you can really try to get everything gone because of the damage that happens throughout the year. So I highly recommend doing it on yourself before you try it on a patient. I absolutely love it. I did one not too long ago on myself. Okay, moving on.
Sorry, when you alternate, is it like every 3 months?
Yep, every once a quarter.
Okay.
Yep. Okay, so now we're going to talk about some kind of big pitfalls with aesthetic record. The biggest thing that I see is injectors will accidentally choose a non-tiered product when they are checking the patient out when they qualify for a tier. What I mean by that is, let's pretend the patient gets 40 units of Botox. Well, at 40 units, they qualify for the tier, which is a discount per unit. So really it means that it'll be less per unit if they get more. The reason why we do it like that is because if someone just wants a lip flip, we don't want you driving to Timbuktu just for a lip flip. So we increase the price per unit. That way we can make sure we can get you compensated for your time. So at 40 units, that's when that price has a significant discount. So within aesthetic record, you have 2 options. You have product But then next to it, you also have variant. Please click on the variant and then the appropriate product that you're going to be using that qualifies for the tier. For Botox and Jeuveau, it's 40, I believe it's 40 units. And then for Dysport, it's 80 units. Any questions? Okay. All right, let's talk about our marketing homework. So this week, there is another kind of big ask, and it is we want you to join a networking group. Now, when you have your launch party, you really reach out to your warm market. Your warm market is going to be your family and friends, everyone that you kind of know that's in your cell phone, essentially. Now you need to start branching out into your cold market. And the best way to do this is going to be through networking groups. What you can do is you can find networking groups really all on social media. They also have in-person networking groups. There are free ones. Please do not pay to join one. But there are several different opportunities for you to kind of get yourself out there. Again, this is getting comfortable with being uncomfortable on the marketing side. So for us as nurses, this is just something extremely foreign to us. And when you look at networking groups, everyone is kind of in the same group of like, okay, I'm just trying to kind of get myself out there. It's a great way to meet people from all sorts of different walks of life. There's a lot of realtors. There's going to be a lot of therapists, a lot of different providers. You're going to meet estheticians in these types of groups. So really, that's the purpose of this, is so we can start getting you to branch out into what is now called your cold market. This week, you're also going to be posting a before and after of a chemical peel. I already have that graphic for you, so it'll be on your homework. You can just go ahead and screenshot it and then post it to social. And then finally, you are going to do one education post on your own about the benefit of a chemical peel that you can create. Now, you're going to continue doing your social media following and follow additional providers. So there are two more providers that I want you to start following. The very bottom one is, her name was Jessie Lee. She is not medicine at all. She is actually, or she was, a network marketer guru. Unfortunately, she died, I think probably about a year ago now. She ended up actually finding out she had cancer, but she was an incredible speaker and really taught people how to get out of their comfort zone and how to market themselves, how to create your own business. And really, as an aesthetic injector, that's really what you're doing. You are trying to create your own business underneath the MFL umbrella. So she was excellent. She gave me a lot of different tips and tricks. And just listening to her, she's very motivating. I will say she does cuss a lot. So if that bothers you, don't, just kind of be cognizant of that. Maybe not listen to it when there are children around. But she was very, very good. So the world definitely lost a bright brain whenever she died. But those are the things for this week. Now, at this point, everyone should have done now their launch party. And I know that, Addie, you had asked about touch-ups for your launch party. So what's going to happen now for those of you who are not on, please make sure that it's 2 weeks post-injection before you do any touch-ups. It will be the finesse treatment, and you can do kind of up to 4 units of Botox, 4 of Jeuveau, and then 10 of Dysport for any type of either ptosis that might have occurred or any still movement that might be occurring. So please utilize that. It's 2 weeks after, but then also it needs to be within 4 weeks of the injection. Again, that's just to protect you so patients aren't coming back 9-10 weeks later being like, hey, it didn't work. And you're like, okay, well, now at this point, it's starting to wear off, or, you should have contacted me earlier. So it's really just a way to protect you from patients taking advantage of the touch-up rule. Does anyone else have their launch party still yet to be had? Nikki, when are you planning on doing yours?
I am having a really hard time. So I reached out to Ashley the other day and talked to her. So
Okay.
Okay.
Yeah. Perfect. Yeah, reach out to Ashley and she can kind of help give you any resources or any type of help that you might need.
Okay.
Yep.
Mine is tentatively planned in April. We had Mardi Gras over in New Orleans. And so just logistics with all of that, it's been rough. So
yeah,
plan for April.
Did they cancel part of Mardi Gras in some places because of the No?
They rearranged some parades, and moved some and kind of just took out some of like the walk-in groups. But no, everything kind of rolled, but it occupies a lot of weekends and good evenings during the week.
I'm sure it does. I'm sure
Options.
it's like rodeo season here in Texas on steroids.
Oh,
I think that's like the
yes.
best way that I can describe
Yes,
what
that's a
what I feel like.
I'm assuming that I've never been to rodeos there,
Yeah.
but I'm assuming that's probably the equivalent,
Yes.
because it's just you can't, and everybody goes out of town. And unfortunately, me and Ashley right now, it's her kid's schedule with ball, my family, who's going to be my clients, ball schedule, and so
All
it's
the
a
things.
it's a wild time.
It is. Yeah. And just, keep talking with Ashley, and
Yes.
the biggest thing that if I can stress to anybody, we are not crazy people. If a life situation happens or you are having a difficult, just communicate with us. That's really the biggest thing. I know it can be difficult to find patients. Please just keep talking with us. Where we find that it gets frustrating for injectors is when that communication stops, and then it kind of leaves us to where we don't really know if you want to continue, if you don't. But we are always here to help you. We will try to do anything and everything that we physically can. So please continue to communicate with us as much as possible. All right. Well, y'all are finished for today right at 27 minutes. So right under 30, holding strong to my promise. I hope you enjoy the rest of your Sunday, and I will see everyone next week. Bye, guys.
All right, bye.
Have a good one.